Did you know that over 1 billion people worldwide may have low vitamin D levels? And the tricky part is, many people don't even realize it. Vitamin D is often called the sunshine vitamin because your body produces it when sunlight touches your skin. But modern lifestyles, spending more time indoors, using sunscreen, and certain diets mean many people don't get enough. When vitamin D levels drop, your body may start sending warning signs. In this video, we'll explore 7 common signs your body might need more vitamin D, based on medical research. But remember, these symptoms can have many different causes, so this video is for educational purposes only. If you suspect a deficiency, it's always best to consult a healthcare professional and get a blood test. Let's get started. Frequent fatigue or low energy. Do you often feel tired or drained even after getting enough sleep? Low vitamin D levels have been linked in several studies to fatigue and low energy levels. Vitamin D plays an important role in cell function and energy regulation, and some research suggests that people with deficiency may experience persistent tiredness or decreased stamina. In fact, some patients diagnosed with vitamin D deficiency report that fatigue improves after their levels are corrected. Of course, fatigue can also be caused by stress, poor sleep, anemia, or other health issues, so it's important not to jump to conclusions. But if tiredness becomes a regular part of your day, it might be worth checking your vitamin D levels. 2. Bone pain or lower back pain. Vitamin D plays a crucial role in bone health. It helps your body absorb calcium, which is essential for maintaining strong bones. When vitamin D levels are low, calcium absorption may decrease, potentially leading to bone discomfort or pain, especially in areas like the lower back, hips, and legs. Some studies have found that people with chronic lower back pain are more likely to have vitamin D deficiency. Over time, severe deficiency can contribute to conditions such as osteomalacia in adults, which causes bones to become soft. If you frequently experience bone tenderness or unexplained skeletal pain, it may be worth discussing with a healthcare provider. 3. Getting sick often. If you feel like you're constantly catching colds or infections, vitamin D might play a role. Vitamin D helps support the immune system, assisting immune cells in responding to bacteria and viruses. Research has suggested that people with low vitamin D levels may have a higher risk of respiratory infections, such as colds or flu. Some studies have even shown that maintaining adequate vitamin D levels may help support immune defenses. However, immunity is influenced by many factors, including sleep, diet, stress, and overall health. Vitamin D is just one piece of the puzzle. 4. Mood changes or feeling low. Vitamin D receptors are found in several areas of the brain involved in mood regulation. Some studies have found an association between low vitamin D levels and mood disorders, including symptoms of depression. This doesn't mean vitamin D deficiency directly causes depression, but it may be one contributing factor in some people. Researchers believe vitamin D may influence brain chemicals that affect mood, such as serotonin. If you notice persistent mood changes, sadness, or lack of motivation, it's important to seek professional help, as mental health conditions have many possible causes. 5. Slow wound healing. If small cuts, bruises, or wounds seem to heal very slowly, vitamin D might be involved. Vitamin D contributes to the body's inflammatory response and tissue repair, both of which are essential for healing. Some research has found that people with low vitamin D levels may experience delayed wound healing, especially after surgery or injury. While many factors affect healing, including circulation, nutrition, and overall health, vitamin D may play a supportive role. 6. Hair loss. Hair loss can be caused by many factors, including genetics, stress, hormonal changes, and medical conditions. However, some studies suggest a possible connection between low vitamin D levels and certain types of hair loss, particularly alopecia areata, an autoimmune condition. Vitamin D is believed to play a role in the growth cycle of hair follicles. That said, hair loss alone does not necessarily mean you're deficient, but it may be one factor worth investigating with a healthcare provider. 7. Muscle weakness or pain. Vitamin D also plays an important role in muscle function. Low levels have been associated with muscle weakness, aches, or cramps. Some people with vitamin D deficiency report difficulty climbing stairs, standing up from sitting, or general muscle discomfort. Research suggests vitamin D may help maintain muscle strength and balance, especially in older adults. This is why maintaining healthy vitamin D levels is often considered important for mobility and physical function. How to maintain healthy vitamin D levels. If you're concerned about vitamin D levels, the best step is to talk to a healthcare professional and consider a blood test. Depending on your situation, they may recommend moderate sunlight exposure, vitamin D-rich foods like fatty fish, egg yolks, and fortified dairy products, vitamin D supplements if necessary. However, it's important not to take high doses of vitamin D without medical advice because excessive amounts can cause health problems.